Hello, family. I am so happy to be here with you today. My name is Quanisha Johnson. I'm a licensed counselor and educator, and we are today on our second session of our theme number 2 in our series, in our virtual series. And our overall theme is the dangerous myth of the strong Black woman. And today in our session, we're going to be discussing anxiety and depression in Black women. And last week, we talked about the dangerous myth of the strong Black woman, and we're going to connect today how anxiety and depression connects to that. So let's get it started. Okay, here we go. Let's talk about this. Okay, as I stated, I'm talking about anxiety and depression in Black women and how it manifests. And so, just a little bit of a recap. Last week, we discussed the idea of being strong. So, I would say for myself that I am a strong Black woman. And I want to reiterate that there is nothing wrong with identifying as strong and being and wearing that strength. It's when we get into some other things that strong cannot coexist with being vulnerable, that we are strong and so we don't feel anything. That is something that we want to get rid of, that notion, that idea of that. So we talked about the idea of being a strong Black woman, nothing wrong with that. It's just as we go on today discussing how, when we just stand on that, how it can be problematic for us with our health. So, what does it mean to be strong? Once again, just going over some things we talked about to make these connections with anxiety and depression. And so, I looked up the definition of strong and we made connections here. Some of it makes sense, and some of it is perpetuating this whole idea of being able to, as a Black woman, deal or handle anything. So, possessing skills and qualities that create a likelihood of success. Okay. And then now we have able to withstand great force or pressure. So once again, looking at this definition, we can withstand so much, but we are also able to be vulnerable. And that great force or pressure can sometimes be too much. Not easily disturbed or upset or affected. Not accurate. You can still maintain your strength, be a strong Black woman, and become disturbed by situations, get upset, get affected. So once again, just connecting the idea that our strength as Black women does not mean that we don't experience the trials, the tribulations, the sufferings, the pain of life like everyone else. So once again, dictionary definition, just picking some of it apart, some parts that are accurate and some parts that can be problematic. Likely to succeed because of sound reasoning or convincing evidence, and powerfully affecting the mind, senses, or emotions, something that is strong. So we're going to go back and look at that the origins of the strong Black woman stereotype. And so basically the strong Black woman narrative came from, really originated in the days of enslaving Black women, enslaving Black people in general, right? It served as justification for we as women having to endure just so much pain, separation from children, beaten, raped, watching our men be beaten and harmed, and enduring all of that, being treated once again like we're not human. So piling on top of us, hurting us, and us doing what we needed to do to survive. And so the truth of it all, of course, Black women are resilient. We have persevered through all of those things plus some. But the myth that stands is that Black women do not possess a superhuman strength. Right? We're still human beings. No matter what, with that idea or concept that we could just pile on top of us, harm us, we are resilient, but we are not superhuman. And we don't have to walk around pretending as if we are. So from that time, there's an expectation, and that expectation has continued. And this is where this whole idea comes from, where we walk around as if it, being strong is means that we have to like not express how we feel and not feel our pain. It's the expectation, and that we're immune to obstacles, we don't feel anything, and that we're self-sacrificing. That idea of that we are, of course, great caregivers and great lovers. We love our family, our children, our friends, but it's so important that has a balance with our own personal self-care. So we want to love on those we want to love on, but not have the expectation that we have to sacrifice everything and not take care of ourselves. And we don't want to have to withstand, or the expectation should not be, because of the origins of slavery, that we can withstand society's abuse against us. And that no matter what goes on, you know what, grin and bear it. You can take it. And so, once again, looking at that idea of strong, that expectation, and not living our lives trying to meet a false expectation of who we are. So yes, yes, and once again, I'm reiterating this all throughout as we talk about anxiety and depression. We feel pain too. African Americans, and these are examples of, we feel pain. We have these experiences. They are valid experiences. Our pain is valid. African Americans experience depression at higher rates than white people. Black women experience higher rates of depression compared to the general population, compared to everyone. Higher rates of depression. Anxiety is more chronic in Black women, and the symptoms are more intense than our white counterparts. And so let's define, when we hear those words, anxiety and depression, we hear them a lot. And so let's give some context to what it is, what it looks like, so that we're able to identify it within ourselves, even within a loved one. So anxiety refers to a feeling, a feeling of fear or apprehension about the future or what's to come. So it's that worry, that feeling about what's going to happen next. And so someone once shared with me this analogy about that worry, that excessive worry. That worry is like a rocking chair. It gives you something to do, but you don't go anywhere with it. So think about when we're experiencing some anxiety, which is normal, which is absolutely normal. We all do. We live in this anticipation of what's happening next. And so with the idea of worrying being like a rocking chair, think about a rocking chair. What are we doing? You are going back and forth with it, right? You're rocking. You're never moving across the room. You're never really going anywhere. It keeps you busy, but it does not produce any results of true movement. So that sometimes is how worry is for us. We are living during a pandemic, and we're all worrying about when this is going to be done. When will we be able to see our family members? And anxiety is on the rise. It's higher than it's probably been in our lifetime. So it's that feeling of fear, apprehension, what's going to happen next, where it takes your thoughts. And so anxiety is common, as I said before, and we want to normalize certain things. We don't want to look at it from the standpoint of, if I experience anxiety, something's wrong with me. And that is something we want to dispel, that whole myth of, if I experience this, then there is something wrong with me. So therefore I must suppress it. I must hide it in order to maintain this idea of being a strong Black woman. So when you're feeling anxiety, totally normal, it happens. But when those feelings are extreme, they're lasting, it's constant over a period of 6 months or more, and they interfere with your day-to-day life, then we would classify that more so as an anxiety disorder. And with anxiety disorder, we see different things. People have panic disorder, where you would see like people having panic attacks, social anxiety, which we'll talk a little bit about in a few minutes, and different types of phobias or fears, extreme fears of things. Then we have depression, because we're talking about anxiety and depression today. And often when we think about anxiety and depression, we talk about them simultaneously at the same time. They look different, but they often go together. There's something called comorbidity. And so comorbidity is when we see, two different conditions that are existing at the same time. They often go together. So if you see one condition, then you often see the other. So anxiety is often comorbid with depression and vice versa. So with depression, depression is a mental health condition in which one feels discouraged, you feel sad, hopeless, unmotivated, or disinterested in life in general. And those symptoms are persistent and long lasting. So once again, I want to reiterate, just like with anxiety, with depression, it is something that is more than I have the blues today, or I'm a little sad. And so you often hear the term depressed thrown around and used very loosely. So we're not talking about being sometimes in a depressed mood. As I mentioned earlier, we're going through a pandemic. And so often we're in that mood. Life's different. There's more challenges. You can't, be with your loved ones, the fear of getting sick and just feeling down about it. Even through the winter season, COVID is compounded by, and vice versa, the idea of the cold, the extreme cold, if you're living in those areas of the nation where it's cold during this time of year. There's lack of sun. I know I'm in the Northeast, so we're in winter still, and there's been a lot of snow. So that's seasonal affective disorder as we see it, where you're more down because of the weather, the lack of vitamin D, the lack of sun. And so ultimately, you might find yourself in a depressed mood during this time, but finding it subsiding when the weather improves, there's more sunlight outside as spring approaches. So we're not talking about those things. Once again, normalizing these things occur, and that we will sometimes feel in a depressed mood. So when we talk about depression, we're talking about these symptoms persisting and being long lasting and needing and requiring an extensive treatment plan, which may include psychotherapy. It may, for some, include medication. It includes a change of lifestyle. So we're looking at depression also from that standpoint, not just how we, like I said, loosely say, we're feeling depressed, we have the blues, we're feeling sad, right? All normal things to feel sad sometimes, to feel a little bit down. Those things we want to make sure that we're letting you know today, that I'm letting you know today, that it's okay. So basically, overall, with anxiety and depression, we're looking at it from the standpoint of if it's interfering with your daily activities. So we're looking at it from the standpoint of we're wanting to be able to, do things in our life, our work, spend time with those we live with within our home, our loved ones, and do our normal activities. And so we're talking about the levels of anxiety and depression that interfere with your life. So here are some symptoms of anxiety and depression. So with anxiety, let's look at that first. And sometimes you'll feel your heart rate's increasing, your heart's pumping, the blood's pumping harder in your body. So your heart's thumping, your rapid breathing. So sometimes people with panic attacks will see that, and the breathing is labored. Trouble focusing, concentrating, because remember, when we are worrying or thinking about something else excessively, it's hard to focus on whatever the task at hand is. And then we'll also see with some trouble sleeping. Your mind is racing. So when it is time to lay down at night, someone with anxiety may find themselves not being able to just rest. Now we have depression. Let's look at that. And some of the symptoms we see with depression will be, closely related to those symptoms with anxiety. So appetite changes, loss of energy. Also, we see trouble concentrating, and we may also see trouble sleeping, but also excessive sleeping, right? You'll find sometimes people with depression will just they'll feel so tired and they will sleep a lot and then still never feel as though they're rested. That constant feeling of just feeling exhausted. And I don't have it up here, but I want to note, which is very important, with people with depression. That's why it's so important to get the help and support that is needed. Suicidal thoughts, suicidal ideation. And so that's why when someone is in need of help and support, that it is so important to recognize and be aware of these symptoms so that the help and support that's needed is achieved. So aches and pains in the body, sometimes, and not understanding why am I achy? Why do I feel these pains? And so overall, the idea of neurovegetative symptoms, and those symptoms are related to your autonomic nervous system. So that is connected to those symptoms with your increased appetite or decreased appetite, even some weight gain, the sleeping, the insomnia, chronic pain in the body. So in many cases, how we may present as Black people with depression may look different than our white counterparts. We often see more neurovegetative symptoms. And that is why it's so important that when we're going to our healthcare professional, that they're aware of symptoms that exist within us. Because remember, we may not be going to the doctor and being so forthright and saying, I'm feeling depression, or because we want to present, and not all of us, I'm not generalizing. I'm generalizing, and I'm not saying every person, but not wanting to go forth and really, really express and present as this strong person. So a medical professional, a healthcare professional, hearing those aches and pains piece and nothing connected to it, or the increased appetite, the decreased appetite, just being aware that those symptoms, right, may be a manifestation of our depression. So let's talk a little bit about why. So we know, and we've discussed the impact of the strong Black woman stereotype. Why, and when we say why, we want to know the whys of this whole idea of, or this these conditions rather of anxiety and depression. So looking at strong Black woman having to maintain this idea of we should present as this person, and that we don't need to feel anything. And so when we think about how we're viewed, how others see us everywhere that we go, how the media portrays us. And we talked about that in our last session, how we're portrayed in the media, how we're portrayed at our jobs. It impacts absolutely how we see ourselves. And as much as we attempt to build this positive self-concept, sometimes it is harmful to see how others see us. It's harmful to our mental health. It's harmful to our self-image, and who we are. And there still exists, of course, a stigma around mental health and depression, and how and not understanding. And I think overall, there's a lack of understanding of how it impacts our community in particular. It looks different in our community because our story is different. And so ultimately, this stigma still exists around mental health. And so we find ourselves maybe, or possibly not, because of that strong Black woman stereotype, because of the fear of how we're being seen, because of that stigma, not being able to get the help we need when we are dealing with anxiety and depression. And ultimately, we have to look at the historical portion of it with mental health. So when the whole idea of psychology was created, right, in its origin, it wasn't for us as Black people. We were not seen as civilized. We weren't given human quiet qualities to feel pain, to experience things. So from the historical framework of it all, there's an understanding of why we're hesitant to go to mental health professionals to seek out care for ourselves, because there's a level of mistrust. And so historically, we don't trust it. And so that stigma exists. And it exists in our community and outside. So how people see us and how we see ourselves as well. So ultimately, mental health, it's so many things are improving with the accessibility, being able to see more people in these fields that look like us. But it's been a taboo subject in our families. And we talked about in our last series the idea of intergenerational trauma and patterns passed down, messages passed down. So the idea of talking to someone, telling your business. So we often, as Black women, live in secret, living in secret, and that's passed down. Don't tell anyone your business. right? Whatever goes on in this house stays in this house. So learning to be silent and having that passed down. And so, and we need to like kind of shatter this idea and break these myths down that dealing with anxiety and depression does not mean that you're crazy. And that you can also receive the advice from family to pray about it. Absolutely do so. But seeking help in addition, helping yourself, seeking the care of a mental health professional, seeking the care of those who support you is important as well. And so let's keep and continuing in our idea of why. Let's keep talking about it. So I mentioned earlier with anxiety that we can see um, panic disorders as anxiety disorders and social anxiety that we deal with. So social anxiety is the fear in social settings. So as Black women, we face so many challenges in our school settings. So whether you're at a college, even young Black women experiencing that in high school, middle school, and in the workplace as well, just often feeling as though we're the only one. I know I have been in many situations in which I was in my college classes, for undergraduate, for graduate school, and being the only Black woman in my classroom, and how that felt. And I am a lover of people, but the discomfort I felt as being the only one. So often feeling uncomfortable because we are in environments where we feel like no one can relate to us or see things how we see it. And that overwhelming feeling existing that when we're in those environments, we have to show up harder, twice as hard, work harder, right, to make it, to succeed. And that fear going into those social settings and feeling that feeling is a lot. Black women having to question their identity, going into a setting being the only one with natural hair, and just often the idea of being identified as, if you talk a certain way, you'll be viewed this way, and just if you talk this way, you'll be viewed that way as a Black woman. If I wear my hair straight, if I wear my hair naturally, and constantly being in a place where we have to question our identity, and that is challenging. So we go into those social settings, sometimes feeling so uncomfortable, feeling anxious about it, and not feeling like we can go in and be ourselves. So these things increasing our anxiety, increasing that feeling of just wanting to go in a space, in a place, and be who we're going to be. And because of all this, sometimes suppressing, sometimes feeling like you can't be yourself. I can't share that when I'm in these environments, I have to stand tall, be a strong Black woman, and not let anyone see what I'm experiencing on the inside. So there are other reasons we experience anxiety and depression. We could experience anxiety and depression because we're going through a severe illness or there's a chronic health condition. There is anxiety with that. Like there are with the COVID pandemic, people, for example, have contracted the virus and are considered now long haulers, in which they are still feeling the ramifications of the virus, feeling ill, anxiety about the virus and how it manifests in us. Will we get better? Just feeling those feelings, thinking those thoughts can make you feel more anxiety, feeling depressed because of a health condition. So I gave COVID as an example, but it could be any illness, which can increase anxiety and increase our feelings of being depressed. um, with substance abuse, we'll also see an increase of anxiety and depression. Having another mental health disorder. And we talked a little bit earlier about the idea of comorbidity, when two conditions are existing at one time. So often you will see, and not in all cases, anxiety existing with depression. And so there's challenges within that. So people having depression, it will raise the risk for them also dealing with anxiety. And then we have family history of anxiety and depression. The family. That was our first conversation in our series, just the impact of family. And so, if there's a family history of that, then one may be more at risk from suffering from anxiety and depression as well. And depression is also treated at lower rates in the Black community. And then when the treatment is done, the care might not be as adequate for us because it's not understood. Like I said earlier, those symptoms we talked about, it's very important that how we experience our depression, that whoever that we're working with, whatever healthcare professional, understands the context of our depression, has understanding of what's going on, how it manifests within us. And so that's more important in our treatment than just getting treated, but getting treated adequately. The way that we're needing to get treated, we want to have treatment the right way that works for us. And it is not a one size fits all at all. So let's talk a little bit about Black women and experiencing trauma. So I'll give you an example of just traumatic events and connected to what we're talking about with anxiety and depression. So sexual assault among Black women is 3.5 times higher than any other group in the United States. And here, this is the part here that connects to what we're discussing about the living quietly, and we are less likely to report. So not only are we experiencing this at higher rates, we're living in silence about it. So think about the post-traumatic stress disorder that comes after being a victim of sexual assault, the trauma associated with that, and then having to live in silence, not telling anyone, not reporting, and living with that pain and feeling like you can't share it, you can't report it. And so racial trauma. And so let's talk a little bit about that. So racial trauma, when we hear that term, or race-based stress, as it's also called, refers to the mental and emotional injury. That word injury. So we think about injury as physical, like falling, getting hurt physically, but it's also mental and emotional injury caused by encounters with racial bias and ethnic discrimination, racism, and hate crimes that we experience on an everyday basis. And so when we think about racial trauma, we see hypervigilance in our community. We avoid things and situations and people. We talked about with a sexual assault situation, PTSD, high blood pressure, digestive issues, weight management issues, heart issues, all of those things. And so with racial trauma, we have the idea of maybe we're not experiencing certain things with discrimination, bias, and hate firsthand, but then we have that aspect of it, which is that vicarious trauma, and which is indirect, but we're living in a world of systemic racism and we're witnessing these things every single day. So we're talking today about Black women, and this applies to Black people in general, but because we're speaking of Black women, think about the idea, racial trauma, that vicarious trauma of watching the news and seeing the deaths, the murder of Breonna Taylor, watching Atiana Jeffries get killed within her home, even going back a little bit, Sandra Bland. So as Black women, my name's not Sandra Bland. My name may not be Breonna Taylor or Atiana Jefferson, but ultimately, when I think about the idea of watching another Black woman lose their life, I'm traumatized. That could be me. That if you have daughters, that could be them. And so ultimately, we're experiencing these emotional injuries on a regular basis, which of course will heighten your anxiety and your depression. Of course it will. Of course it will. So we are experiencing situations of trauma. And then remember, going back to that expectation, we're expected to be okay, to show up a certain way. But once again, we have pain, we experience pain, and we're going through this on a daily basis. So let's look at this idea that we have in bullet number 3. Look at those symptoms: high blood pressure, digestive issues, weight management issues, right? Not being able to sustain our weight, heart issues. Think about heart disease and stroke with Black women, right? Think about obesity. Think about these things. And there is a correlation between those things. So experiencing anxiety and depression and all of those things I just named, right? Think about that. Think about our lifespan, like the long-term impact of dealing with the stress, cardiovascular disease, the stress, the anxiety. Think about what the body has to do. We always think about those symptoms that we could visually see, right? We could visually see certain things. So we know how something manifests when we can see it. You could see if I was anxious and physically shaking, and now because I had so much anxiety, you'd be able to see me do that. But we don't think about internally what happens. We can't see the blood pumping harder. You may not know my breathing is labored, that my heart feels as though it's gonna pump outside of my chest. You may not know that. I could feel that. So the work the body has to do, right, to come back down, to go up and come back down. So that long-term impact, that chronic stress, what it does to us long-term in our health and our well-being. And so once again, the idea of it being so important that we get the right care, that we're cared for in our community the way that we need, is so important. So although I named all of those things with heart disease, high blood pressure, diabetes, obesity, there is not a lot of research to correlate stress and cardiovascular disease in our community. The research isn't being done so that there could be more resources and more support. So this is why we struggle sometimes. So there's obviously a correlation, but not enough research. Because with the research, they can come up with more solutions and more support for us. And so ultimately, we're dealing with this trauma on a daily basis that makes us physically, mentally, and emotionally ill. Then we have the idea of microaggressions. Talked to you earlier about social anxiety, going into your workplace, going into the school, that your college, and of course experiencing microaggressions, which are everyday insults and slights, which have a harmful and derogatory impact. And I want to give you an example. A few years ago, I went to a museum with my daughters, and there was a woman, and it was on Dr. Martin Luther King, the celebration day for him on a Monday. Went to a museum, and the exhibit, they had events. It was beautiful, celebrating the life and legacy of Dr. King. So we are getting a tour of an exhibit in the museum, and I can't remember the exact way that this occurred, but the woman giving the tour, she was a volunteer at the museum. She she was talking about, to my daughters and I, with natural hair. She gave an example of something and said, and compared our hair, being the texture of something being rough like our hair. Once again, on Dr. Martin Luther King's day, and with a smile, telling us a story and about something in the exhibit, and making the connection of rough and our hair. Microaggression. She smiled. She was just telling a story. She was giving an example. She had no idea, because she visually saw something, right? She assumed that our hair was rough. And so ultimately, microaggression, it's those little digs, those insults. She didn't say it in a way that was intended. So we think about, with microaggressions that we as Black women experience, it is insult, right? Intent versus impact. She could say, I didn't intend to be harmful, but what was the impact? And as Black women, we're experiencing that every day. We're often very hyper vigilant because we don't know what we're going to walk into, causing us to feel more stress. And so I ended up, my daughters walked away, and I ended up just having a conversation with her and explaining the harm in that statement to my young daughters. My daughters were very young. They're a little bit older now, but at that time, and the harm in that. And standing there and hearing someone refer to their hair as being rough, right? And I explained to her, I said, sandpaper is rough, right? We don't want to touch it. So just giving her that conversation, and she was very receptive, but educating her on the harm of just what she intended to be a harmless comment. So just experiencing that on a daily basis, racial trauma, vicarious trauma, microaggressions. And so dealing with that, heightening our anxiety, heightening our depression, making us feel down about ourselves, our situation, the hope for the future, the hope for our daughters. And so much compounding on top, one on top of the other. So this is something that I want to share with anyone feeling as though their pain, their experience, what they've gone through is invalid. I hear you, I believe you, I support you. It doesn't matter what they think. And once again, when we think about mental health, and we are not here to be the judge and juror of someone's experience. So we have now going on in the news. There was the interview with Meghan Markle and Oprah Winfrey, and I'm not going to get into full-fledged details and talk about this in depth, but just the idea of a woman, a Black woman, no matter how she identifies, right, speaking about mental health, about her suffering, about suicidal thoughts, and not being believed. And I just want to say that your feelings are valid, that this woman did ask or express to us that she asked for help and could not receive it because how it would look. That perpetuating the idea that we're not supposed to feel pain, that your mental health, the subject of it, getting support is so taboo that we would rather people suffer than get the help that we need. Of course, within our community as Black women, there is going to be an increased anxiety, increased depression if that's the case. So we're needing to be heard, believed, and supported. Everything that you go through is valid. Your experiences, no one can come across and tell you that that's too small, or you shouldn't feel like that, or you're going to be okay. All those little isms and things that people tell us that are not helpful, but more harmful. You are not being oversensitive. You're not overreacting. You're not being dramatic. And I just want to reiterate that as we start off in the beginning of this conversation, even going back to last session, of the idea of the strong Black woman, and the idea that we are so self-sacrificing, or that we need to be, that we can't balance helping others with what help we're needing for ourselves. That in that situation, when we are watching as a Black woman, when I'm watching another woman of color, a Black woman, however you want to label it, talking about suffering and going through something that was detrimental to her health, and hearing that she's not believed or she couldn't get the help that she needed, could be detrimental for those listening or watching. And so reiterating the message again today, of the importance of taking care of yourself and getting the support that it is needed, and that it matters that you believe you, that you know you're suffering, you know what you're going through. And so just remembering that with depression in particular, when depression in the early stages of it, if you get the support that you need, you can overcome it. You can overcome depression with the proper supports in place. And also reiterating that we're not talking about just being sad or a little anxiety because you have a job interview tomorrow and you want to do well, but I'm talking about where it is interfering with your life, that you don't have to suffer in pain, you don't have to suffer in silence, that you deserve and need the support that you need to get. And so I want you to take a moment to care for yourself. And I think it is very, very important that I explain that the cure for when you're feeling when you're feeling your pain, you're experiencing depression and anxiety disorder, we're not talking about someone telling you go to the spa. That's not the answer. That's great if you're able to do that and that it helps in some way, but that is not going to care or deal with the root issue that you're experiencing, right? So ultimately, when I'm saying take a moment to care for yourself, it is not that simple. Someone, if you're experiencing depression, the answer is not just go ahead and go get your nails done. It's great to do so. I'm not diminishing any act of self care. They're all great. But in this situation, this conversation today, we're talking about anxiety and depression that we're going to need help outside of ourselves for. That's what we're needing. And so ultimately, it should always be taken seriously. Your anxiety and your depression should always be taken seriously. And it's not as simple as those acts or those tasks that I just talked about. And so when I am saying take a moment to care about yourself, this is what I'm referring to. So when we're caring for us, we have to make sure that we're aware and accept what we're feeling. The idea is not to feel something and then push it away because we can't show people we're not allowed to be vulnerable as Black women, and that we can't deal with that right now because we have to do this for this person or these people. It is very important, the awareness. And that's what I mean about take a moment to care for yourself, being aware and accepting. So if I am someone who anxiety is starting to take over my life, and I'm not able to function in a way that's healthy for myself and healthy for my family, I need to be aware of that and have acceptance, because there's help and support there. It's not all dooming. It's not, oh, now my life can't function. I am dealing with this mental health condition or these conditions. And so now I can't do the things that I need. No, it's opposite. The awareness and the acceptance would help us. That's step one to moving forward. So, one thing I want you to do in terms of caring for you, you have to be aware of your body. Check your body for signs of stress and anxiety. It manifests different in every single person. So when I'm working with my clients, I'm always asking when they're experiencing these things, what does it look like for them? We talked about the symptoms earlier and we said, somebody might have with depression less sleep. Somebody might have be going through excessive sleeping. So there's so many different ways that things manifest. If you're experiencing anxiety, you may feel like you are going through those bouts of shortness of breath. But I may not feel that. I might get headaches. And so ultimately, if you're feeling what you're feeling, remember, it's all valid, it's your experience, and it all looks different. So if you're experiencing, we talked about the symptoms, not that one day where it's just a stressful day, you're having some anxiety about what's to come, and so you have a headache, or something in your life, a situation occurred, so you're feeling in a depressed mood, but maybe the next day you're okay. I'm talking about paying attention to the signals in your body. If you're finding that your heart is racing constantly, you're feeling that shortness of breath, having that panic attack, if you're getting constant migraines, aches and pains, I want you to pay attention to your body. That's how you care for yourself. That's how you have awareness. You do a body scan. You realize, where is this existing in my body? How am I struggling? So when you do talk to a healthcare professional, you can talk about how this is manifesting within you. So I want you to check your body for those signals. Be aware of them. Don't brush them off like, oh, I always have a migraine. Oh, I never sleep at night, so that's not a big deal. No, no. I want you to, this is how we do this in-depth self-care. And like I said, we can add on other, things like, going to get our hair done, or little small tasks to boost our moods, make us feel good. Absolutely. But I'm talking about the in-depth self-care when you are being aware of how something impacts you directly. So check for those signs in your body. Increase your self-awareness through journaling and mindfulness activities. So I'll start with the journaling. Just writing things down to get things out. Sometimes I give an activity to those I'm working with to write down for just 7 days until our next time together, just daily thoughts. And so then we can look for a theme. So are there daily thoughts, things that you're worried about, what your experience is, putting it down, and then at the end of the week looking for patterns. So looking at what areas are you're struggling with the most. So journaling is a great way to kind of get those feelings out, to express them so that they're not bottled up. When we think of the idea of mindfulness, so the anxiety, for example, when we are experiencing anxiety, a lot of that, the idea of mindfulness is just bringing us to the present, because sometimes in life we are way behind us in what happened in the past and anchored there. And then in many cases we're so far ahead that we can't focus on the right now. We can't focus on how's my body feeling, what's going on right now, what's in front of me. So the idea of focusing on the present moment, what's right in front of you, what can I control right now, what can I do for myself to get help and support right now. And so mindfulness, just the focus on the present and what you're needing. And that true self-care is saying, I might be suffering, I'm struggling, but I don't have to sit here quiet about it, that I can get the help and support that I'm needing. And that's the important. I'm able to be a strong Black woman who's also vulnerable, who also suffers from depression, who also has anxiety, who also loves my family and wants to help them and do my best. Two things can be true. Three things can be true. So just practicing those activities, remembering to take a deep breath. You know, a lot of times with anxiety, we don't have control of our breathing. We feel like we don't, but just stopping and taking deep breaths, slowing ourselves down a little bit just to catch our breath. 3 deep breaths, just starting there. Discuss what your feelings are, um, so that you don't internalize negative experiences. So when we're sitting and we're living quietly and we're keeping it all in, and we're having this experience in the workplace or out in the community, and we have it inside and all of these thoughts are taking over, we're internalizing it, we're looking at what's wrong with us, and internalizing will make you feel sick, will make you ill. It will cause extreme stress. It will cause extreme anxiety. And so it's so important that we have this outlet to work through what we're going through. So when I talk about caring for yourself, this is what I'm talking about. I'm talking about accepting what we're feeling, being aware of our bodies, what's going on, and increasing that self-awareness through these activities and not internalizing. And I'll add to this internalizing, we also don't want to externalize. So what we externalize, we want a healthy outlet. We don't want to lash out at those around us. We don't want to take what we're experiencing and just give it to others. So sometimes when we're going through so much stress, when we are depressed, we sometimes the person or the people in closest proximity to us will get the brunt of what's going on the inside of us. And so just being mindful of internalizing our pain and also not wanting to externalize it and have others, suffer as well or deal with it in a negative way. So what's so important that I want you to do is to seek support. Seek support. Don't live in silence. Everything that was created to hold us back, to stop us from succeeding, we have to work towards unlearning things and work against those things. We don't have to be quiet. The images created for us that are inaccurate. We don't have to live up to that. We don't have to be in this place where we can't just be who we need to be to live a healthy life emotionally, mentally, and physically. So you don't have to live in silence. We as Black women need a therapist who will understand our issues. We need someone to understand our issues. And I think it's so important now. Things are changing. I'm so happy that, there are more professionals that look like me in the field, and you can seek out that help you need. You don't have to, because I think in the whole idea of getting support, it's about getting the right support, getting support that works for you and looking at it from that standpoint. And I think that part is so important. And of course, I am talking about, when we're dealing with depression, I said earlier, you need an extensive treatment plan. And it may be, it's the psychotherapy with the medication if necessary, and then an overall lifestyle change. That is a plan that's tackling it from different angles. And so it's not just, like I said a few slides back, of just practicing very surface level self-care, which is important as well. But it's when you're dealing with depression, it has to be tackled at a level that will really, really help. So that's so important. So once again, looking at dealing with anxiety, dealing with depression, and not breaking the stigma away from it, normalizing it, not in the sense where it's like we want to say it's okay. And this is just where I feel depression, or I have depression, I'm just going to try to power through. No way, no way. But in the sense where we're human, we go through things, we experience things, we have struggles, we deal with all types of issues, and we deserve and need support for those issues. And that if I express that I'm suffering from depression or dealing with anxiety, that I deserve to get the help I need just like anyone else. So ultimately, there's importance in seeking a culturally competent professional, no matter what that is, whether it's in your primary care doctor, and whether it's in, if you see a psychiatrist, whether it is in the idea of seeking psychotherapy, someone culturally competent. And in cases, that we're talking about in these areas, the person may not look like me, but they can still be culturally competent. They can understand that there's certain symptoms that we experience as Black people, and how it manifests. They could be aware of the microaggressions. They could be aware of the racial trauma. They could be aware of the systemic oppression that exists, and be able to support you in the way that you're needing. And that no matter what psychology book or what they studied in school, that there is, once again, I said earlier, no one size fits all treatment. Treatment is personal to you. So it's really important to seek out what you need. There are some great resources out there. I'll give you one, for example. There is a directory, is Therapy for Black Girls, that exists. You can find a culturally competent professional on there that looks like you. You even on just basic psychology today, you can type that in, and if you're looking for a certain culturally competent professional, someone looking like you, you can find someone on there. You're even able to, if you have an insurance company and you are looking for people to work with you in a specific area, when we fill out these directories or our forms as therapists, we are categorized. Someone's a trauma specialist. You're categorized as an African American professional. Those are all, whether you're a woman, all of those things are categorized. Your insurance company, if you call them up and specifically say, I would like a therapist that is a Black woman who specializes in trauma, they can go into their database and find that. We categorize that. So I want you, like I said, to seek out whatever support you need that works for you. That doesn't work for someone else, but works for you. It's very, very important. Once again, I hear you, I support you, I believe you. And that's the message that we need to give to each other as Black women. And we want to make sure that everyone gets the support they need, especially when dealing with mental health conditions like anxiety and depression. seeking support, if you are feeling as though you're needing support on a level because you are having suicidal thoughts, it is so important to get the help that you need. We want us to be here. Yes, we said earlier we are resilient and have persevered. We want to keep being resilient and persevering, but get the help that we're needing. We don't have to, once again, live in silence. So here, I wanted to put this number up. It's the National Suicide Prevention Lifeline. Um, you can store this in your phone, share this with a friend if needed. Just have this number handy, because it's so important that if someone articulates that they are suicidal, that they be taken seriously. Remember, not being oversensitive, not being dramatic, being believed and being heard is so important. It is not up to us. It is not up to us to investigate in a sense where, like, I don't think that person's feeling like that. Oh, they're just saying that. We need to be taken serious. Our concerns are valid. Black women, your concerns are valid. It's so important. And I have the crisis text line. You text the word home to the number 741-741. It's 24 hours, 7 days a week. It's a crisis counseling text line. I'm so happy that we're in a time where we're texting and we can get supports on all levels. We can pick up the phone and call. You can physically go somewhere if you're needing to even go. If you're in crisis and need help immediately, your nearest emergency room, right? So we got to remember that in a hospital, there are resources there for physical care and there's resources there for mental health care as well. So if you are needing that, please get the support that you need. If you need it, if you're dealing with depression, if you're dealing with anxiety, any other mental health disorder that is overcoming your life, please get the help that you need. And so now we're at the portion of our reflection activity. And so let's look at what we're going to do today. So the idea of, dealing with our negative thoughts. We have challenging negative thoughts all of the time. Thoughts that replay in our heads over and over again, second guessing ourselves, doubting ourselves, the anxiety, the extreme worrying, right, that we're feeling, situations in our life that we feel like we have no control over. So in today's reflection activity, I want you to do a journal prompt on challenging your negative thoughts. So get out your journals, and I'm going to go over the prompts with you to write. And remember, we're doing this today because our negative thoughts often dictate how we see ourselves. Our negative thoughts dictate, we sometimes have these thoughts and we say, oh, I can't tell anyone I'm thinking this. And then you keep them there and they replay in your head. And that's why you might not be able to concentrate or do your normal activities or do things that you need to thrive, because these negative thoughts play over and over and over again and impact how we see ourselves as Black women. What is one negative thought that you are having? So I want you to just do some reflection in your journal. A negative thought that replays in your head, that keeps happening. And so sometimes we're so busy in life and we're moving, and so we're having these negative thoughts, but we don't take time to dissect them. And they need to be dissected and pulled apart. So I want you to reflect on, what's that negative thought? Or if there's more than one, you may write that down as well. How does that thought make me feel? So I'm having this thought. How now? Because I'm thinking, right? So it goes like this. I have a thought. I then have a feeling as a result, and then I act a certain way. Thoughts, feelings, actions. And so I think something, it makes me feel a certain way. And then I now am going to have a behavior that's going to be next. So I want you to tell me the thought, or tell yourself the thought in your writing, and how does that thought make you feel? Because it will impact how you behave. Then, as we dissect, is there evidence for my thoughts? Is there evidence for it or evidence against it? Sometimes we're in this holding pattern of these negative thoughts, and we don't dissect them. We just think them, we feel a feeling about them, and we keep going, and they replay over and over again. And so, or they came from a place that negative thought was passed down, or it's society's message that's untrue. So is there evidence for my thoughts? Or if I really look at it, is there evidence against it? Sometimes when I am in a session and I challenge the negative thoughts, we do this process together, and I ask for evidence of where it comes from. I hear silence. I get silence because they don't know. We get into these negative holding patterns and we just don't know how to shake them, and they need to be dissected. And you might struggle with this part of it, not understanding, but it's just me wanting you to work through or try. And this may be something that if you have a therapist, if you have someone that gives you support, something you can work through with someone else. And do I have all the information that I need to interpret the situation? So now I have these thoughts, these feelings, and there's a situation going on in my life. And I'm making an interpretation that's dictating everything, that's making me feel anxious, that's making me feel down. But do I have all the information needed? Do I know, am I making an assumption, or do I have everything that I need to make this assumption, or am I just making the assumption? And so, like, do I have the information? If I were to sit here and look at the situation positively, what are the differences? And I know sometimes when we are dealing with depression, right? I'm talking about chronic, major depressive disorder. This activity is challenging. We can't, our minds won't allow us to do this, and I totally understand that. So I don't ever want to minimize the symptoms of anxiety and severe depression. Sometimes it is hard until we actually get the extensive plan in action, or working with someone extensively over time, or that medication or whatever it's needed. It's hard to see things in a positive light. But if you're able to do so, if I looked at the situation positively, what might be different, and look at it from that standpoint. And so take your journals, try to answer these questions, and try to reflect on these things. And it's important that we challenge some of these thoughts, because there is so much that was so many false messages, so many false messages, even about anxiety and depression, how it impacts us as women, as Black women. And so the very important message that I want to leave you with today is to make sure that if you are struggling, that you feel strong enough to get support, that you can be strong, you can take care of your family and still need someone to support you, that we don't have to live quietly, we don't have to live in silence, and that anything that we're needing to get, that we go get it, that we get what is needed for us. And so I think that's an important message. I thank you today for listening to session 2 on anxiety and depression, how it manifests, and that recap of the strong Black woman from last week, and hearing that and making the connections. I hope today that something that was shared with you is helpful, or that you even take the information and help another Black woman, that you tell another Black woman that I hear you, I support you, and I believe you. So as always, family, take care of yourself, take care of each other, and then be well. See you next time.